to the webcast series. Today's presentation is entitled Leveraging Data to Close Care Gaps and Engage Patients, presented by Deb Donovan, Director of Operations at Dairy Medical Center. This is an extremely important topic, as many of you are straddling fee-for-service and value-based care. And for those who are taking on risk contracts or participating in ACO, one of the most difficult challenges beyond analytics is how best to engage patients, not just those that are high risk, but helping to improve chronic care and prevention across your population. As we get started, I want to ensure that everyone's familiar with the webinar control panel. First, you should have a control panel on the right-hand side of your screen. You can easily minimize and expand this panel by clicking on the red arrow in the upper left corner. Second, you could submit questions using the chat panel located, using the Q&A question and answer panel located in the bottom portion of the control panel. We really would like to hear from you and encourage you to ask questions as we present. We will take time to answer as many questions as we can during the Q&A at the very end of the presentation. If your question was not answered, we will be sure to respond to you individually after the event. Finally, we're very happy to announce that all registrants of today's webinar will receive a copy of the white paper, Patient Engagement, an essential strategy for population health. We hope this guide will help your organization implement a workflow-friendly patient engagement program. Now let's get started by introducing Deb. Deb Donovan is the Director of Operations at Dairy Medical Center, the largest privately owned family practice in New Hampshire. She is responsible for overall operations and staffing of 5 locations and over 30 providers, and has worked with Dairy Medical for over 15 years and is project manager for the Patient Center Medical Home Program as part of the New Hampshire Citizens Health Initiative, which was piloted in 2009. She was also a team leader for NCQA Level 3 certification in both 2009 and 2012. She has received numerous awards for her work in Breast and Cervical Cancer Initiative pilot held in 1997, which is now a national program called No Women Left Behind. In addition, Deb is an active chair and member of the Northeast Allscripts Regional Users Group Board of Directors. We're very pleased to have her with us today. Before we begin today's presentation, just wanted to make a couple notes. One, this presentation should last approximately 30 minutes, and we'll have a few introductory slides, and then we'll hear how Dairy Medical Center has implemented a proactive approach to patient engagement by closing care gaps in both chronic and preventive care. Just a few opening slides. To achieve the triple aim, there's been a number of numerous articles on waste in healthcare, and this article from Health Affairs does a pretty good job of outlining several areas where we're seeing today's emphasis being. One, around failures of care delivery, in essence having a patient available for care and not addressing all their chronic care or preventive needs, otherwise known as gaps in care. Secondly, care coordination, proper coordination of care across the entire medical neighborhood, acute care, ambulatory, and post-acute settings. And third, over-treatment. In this case, the focus has been around the topic you might have heard of as variances in care or variances in care delivery. We're going to spend most of the presentation talking about the first opportunity, care gaps in care delivery. New England Journal of Medicine published long ago that, on average, 45% of recommended care based on evidence-based guidelines is not occurring. There's an opportunity to leverage the data you already have within your EMR to use that information to engage patients across your population. So where do you start? If you take a 40-physician organization with an average of panel size of 2,500 patients, you have a population size of over 100,000 patients. And within those 100,000 patient population, there's over 37,000 care gaps that can be addressed. In many cases, it takes numerous attempts to try to reach out to those patients and engage them to help close gaps in care. So where do you start? We believe the best place to start is implementing a population health model that will successfully set your organization along the path of continual quality improvement. To begin with, you need to identify populations at risk, then perform patient cohort analysis, both for care gap and risk stratification, and then engage those patients in needed care, coordinate and manage their care, and measure your progress. you look at the process across a population, you can stratify your population mainly into 4 groups: well at risk, chronic, curing, catastrophic. With well, there's different strategies in each of these groups. With well, the goal really is to increase the health of your population by encouraging your patients within your population or people within your population to adopt and maintain healthy lifestyles or wellness. For that risk, reducing or decreasing unhealthy behaviors by encouraging people to stop bad or unhealthy behaviors like smoking, an at-risk category. Third, proactively taking steps to minimize or blunt the migration from well to unwell in patients with known diseases or conditions or disease management. And lastly, take steps to deploy care management resources to accelerate the migration from unwell or crisis status towards well or stable status. With that framework in mind and Lean Six Sigma approaches in mind to help improve the process, I'd like to introduce our presenter today, Deb Donovan, who will speak to you about the journey Dairy Medical Center started years ago to help better manage the chronic care and preventive needs of our patients. At this time, it's my pleasure to introduce to you Deb Donovan.
Thank you, Guy. Hello, everybody, and thanks for joining the webinar. I was actually asked to speak for Fytel on behalf of our experience with the Fytel product, which we started back in 2010, where we had the Fytel Remind system, and we added the outreach system. And the reason that we did that is we had been asked to be a pilot site for the NCQA Patient-Centered Medical Home Program for the state of New Hampshire back in 2009. And the program started with us having to do additional outreach to patients, that we were struggling trying to capture for, what we call now gaps in care. But back then it was how do we capture the 2 different types of patients that we have. We have the patients that come into the office and we're able to take care of when they're here, and we have the patients that come into the office, but they only come in when they're sick and there's nothing preventative. So our process back then was manual. So just to back up a little bit, we are an independent family practice in Derry, and we just celebrated our 50 years of primary care in the town. We have been an NCQA Patient-Centered Medical Home Level 3 twice since 2009. I have 16 family physicians, 12 PAs and nurse practitioners. I actually have 3 nutritionists. We added 1, and 4 health educators. And we do have a diabetic nurse practitioner specialist, and we have also employed a chronic disease psychologist that specializes in depression and things like that that go along with chronic disease management. We have 5 locations, including a diabetes and wellness program, which is a whole separate building, where we have diabetes health educators and a nurse practitioner. And we just opened up a fitness gym and studio for our patients to join for our motion therapy, we call it, program. So what we did was we found that we didn't have enough staff to capture all of these missing gaps in care that our patients seem to have. And we manually focused on our A1C reports, which we could run off of our EMR that we've had since 2001. And our physical exams, and just manually entering our recalls, trying to capture this small amount of patients that were in our system of the 45,000 active patients that we have. So when we spoke with Fytel, they had a great solution for us to do an automated outreach so that we didn't have to hire all kinds of staff to manually try and figure out who was missing, different protocols. So, Guy, if you go to the next slide, please. Guy. Thank you. So here's just a sampling of the protocols that you can set up based on what we did with NCQA, our diabetes program, our wellness program, what we felt were our top chronic conditions. You could do things on missing labs, missing immunizations. And these protocols are all set up by Fytel, which was very helpful and we were able to set the parameters in time. So what we would do is we would say, for instance, if a patient needed a diabetes follow-up, we wanted that follow-up to be within 3 months of their last visit. And you're able to capture that data through your billing system so that the system knows that if a patient hasn't come in for that specific condition or specific lab, the Vitel will automatically send out a phone call to these patients basically stating that they are due for a certain thing. So whether it be labs or follow-up on an A1C, or they needed an LDL, or they haven't been seen for their hypertension and they need to come in. And it's a very simple message that goes out to patients that was very helpful for us because we could see how many phone calls this was generating each month and all the patients that were captured. And we were able to make special appointment types so that when the patient called for one of these conditions to book their follow-up after the reminder, we had a special Vitel appointment. So we ourselves could capture how many appointments in a day were generated through Vitel, which helped us realize what our return on investment was after getting the product. So what we're trying to do is capture not only the at-risk patients as the NCQA Medical Home was asking us to do, but we're trying to capture a lot of these patients before they become risk. There's certainly 2 levels now where we're focusing on more of the preventative conditions than actually trying to, hopefully over time, treat the chronic ones, because we're capturing everybody more often, more frequently by coming in. And these phone calls are made on a regular basis. So this slide actually shows that we have identified which protocols that we want to use, and we as a practice set the frequency on how often we want those phone calls to be made based on the condition that we wanted to reach out to the patient regarding. So there was a lot of setup time, and there was a lot of involvement with Vitel to help us decide how we were going to set that up and when the phone call should be made based on HEDIS, based on just a lot of what the medical home is asking and how often these people should come in. And these phone calls were made 3 times to the patient within a certain time period. They can ignore it, they can reject it, and if they do that, what happens is the system will call them again. So we don't go away very easily, and we will call them and remind them again. And this will continue up to a month, and if they don't respond, then they get put on the risk report. And then we manually try to contact them via a nurse or a medical assistant, or somebody reaches out to them. We can also do campaigns, which I'll speak about in a second, as far as sending out emails to contact these patients to remind them that they do need to come in for these conditions, and it's probably their best interest and for their health to come in to have these conditions treated or reviewed and follow up. So based on all of that, we have received quite a few patients that have actually thanked us for reminding them to come in for these appointments, because I'm sure, as some of you know, patients will check out at the front desk and say, oh, I will call you for the follow-up, and then life happens and they forget to call. And these outreach calls actually help bring in quite a few of these patients for these follow-ups, because they do forget. They forget even a regular appointment when they don't get a reminder call, and they're all upset because we didn't send them a reminder call. So patients actually like this process because it's automated. It reminds them, and it'll call them for different. If they have multiple chronic issues, it will call them based on that chronic issue. And if we take care of multiple issues during one visit, it'll capture all that through the billing, so they won't get another phone call for a different condition next week. So we as long as it's a billable event, it'll get captured at the time that the patient is there. So there, like I had said earlier, there are scripted communications to contact the patients based on what the protocol is, and it's system generated. It's a computer voice, and it's HIPAA compliant, so that we're not giving too much information on the reminder call if it's answered by an answering machine. We can see how the patient responded to the call, if they ignored it, if they hung up. So we're able to see, based on the many reports that Vitel provides to us, how this patient responded to the call, if they've made an appointment, if they came in. We also use this for our NCQA certification. We were able to state that we use the Phytel product when we attested for the certification for NCQA on a few of the elements, and I believe over the next year or so there'll be more elements for anybody applying for the NCQA patient-centered medical home, that if you use the outreach product through Phytel, they're an accredited company through NCQA, that you do not necessarily have to prove and send in all kinds of documents as far as your community outreach and population health. So this was a great benefit to me because I was the one doing the NCQA application, and it saved me the whole population health section and saved me a lot of time. And another thing that was great for us is the reports that we get on a regular basis for a quarter. We get our quarterly summary reports that shows us the big picture of our outreach efforts, which we find very helpful because we know how many patients were contacted, and we know how many patients responded. We know how many office visits it generated. And it was really a great picture of, especially the first 6 months when we were on this, as far as we really, the return on investment was huge. We found that because of all these outreach efforts, these patients were actually coming in and generating office visits, which was obviously the income to help pay for the product. So we found that extremely helpful. And doing this now for 4 years, we're seeing a huge difference as far as our patients returning and following up. We have great report card numbers with our insurance companies for quality compliance. And since we've set the the goals and the parameters of what we're looking for when these patients come in, it's actually helped us take better care of our patients, which goes to the product that we're currently using, which we've started within the last 3 to 4 months, called Coordinate. And what Coordinate does is it breaks down the patients by chronic disease. It can break it down by labs due. We've reached out. Actually, I'm sorry, I skipped a section. So just with outreach, we have contacted over 15,000 patients, and we attempted over 15,000, and we've actually contacted 15,003 of those patients. So we had a success rate of contacting patients at 95.5% of actually reaching somebody, which means that our demographic information was fairly decent to be able to have contact with those patients. Now, the number where it says patients responding with adherence event, that basically tells us that over 5,000 patients actually came into the office based on that outreach, which is a fairly large number. Can it be larger? Absolutely. We would love it to be larger, but not all of the billing data might have been captured for when that patient came in. So if they did come in for diabetes and they had hypertension, we may have only billed for the diabetes for that visit, and it didn't capture the hypertension. So I'm guessing that number of 5,000 might be a little bit higher than it is, but that's what we're seeing as far as this is 5,000 or 5,200 more patients that we would have not captured if we hadn't done something automated, because we were focusing more on physicals and just A1Cs. This captures a very large amount of different protocols with asthma and other things that we weren't able to capture back 4 years ago like we can today with this product. So the next slide actually shows a sample of what the population management system looks like when you bring it up. Okay, you want to go one more slide? There we go. Excuse me. And what this does is it's a nice picture of what you can pull up for the entire practice. You can get a practice average, and this particular slide will show you, the annual A1C testing. It'll break it down for your A1Cs greater than 9, less than 7, your LDLs, and you can set all of these measures as far as what you want to measure as a practice. And then it will compare that from site to site, from provider to provider. It'll give you quarterly reports so that you can see if you're improving. And it's a nice breakdown that where you can query the different tests or the different conditions that you want to look at. Now, this is on the administration level, which is where we're looking at all of this to see how our practice is doing. You can compare one practice location to another practice location. Excuse me. You can compare physician to physician. which we will be incorporating this year as far as the annual reviews for our providers, docs, nurse practitioners, and physician assistants, because we're really focusing on the quality of care with our patients to make sure that we're capturing the gaps that they should be looking at as patients are being seen. And one of the things that we struggle with, or did struggle with, is when you have a patient that comes in, especially in primary care, for, let's just say, an acute visit, a sore throat. It's really hard to capture a lot of these people in the amount of time that you have to see them. And there's a product, in addition to this Insight product, which is called Coordinate, which is actually the next slide. And what this Coordinate piece does is it captures, it's a dashboard, it's a live dashboard based on your schedule for that day. And this is what our MAs use to notify the providers of any alerts or recommendations for that patient when they come in today. So whether they're there for a sore throat, or they're there for a follow-up of their diabetes, or they're there for a physical, this dashboard tells us what the patient is missing, meaning we've set up in the system to tell Vital that all of our hemoglobin A1Cs are going to be documented here, and our colorectal cancer screening documentation is going to be in a certain place, and they take an interface with that so they know that the information in the chart is missing. Now, that being said, it could be in the chart somewhere, and it may just not be documented in the correct place, which I'm sure some of you run across, because this still happens to us, where somebody manually documented or put it in as free text, but it wasn't put in a place where it can be extracted as part of this daily dashboard. So our MAs will put this in the reason for visit for the provider to basically say, Joe is missing his colorectal cancer screening, and his hemoglobin A1C hasn't been checked in over 3 months. So when the provider goes in and looks at this, he can talk to the patient right then and there without having to search the whole entire chart for some of these things. There's also a way through the Insight product for the docs to go back each day and look at it themselves. So if they want to see their patients for the day and see who's coming in and potentially see what's missing, the providers can also do the same. But we found that the MAs helping them, they do what we call pre-visit planning or the visit prep, and they'll look at that on a daily basis to see what's missing. What we're incorporating now is that the MAs are going to be looking at this a couple of days in advance, so that if the patient is missing anything lab work related, they can ask the patient to go and have that done prior to coming in for the visit. So Coordinate, we've only been on for a few months, and we're still working the process of how we're going to do that within our workflow. But the way that we started seems to be a good flow for right now to try and capture some of the things that we find are missing on a regular basis. And it seems to have been working out very well so far. The next slide shows you, we'll go back to the Insight piece, but this kind of shows you a cluster of all the patients. Every dot that you see on here is a cluster of patients practice-wide, and you can set your report parameters on this at a whole different level than the last slide I showed you. So you could, and you can't do this live, it's nice to see live all the different colors, but you can actually break this down into your age range. You could break it into your, like this one is actually showing the age range of 18 to 75 with a hemoglobin A1C of 0 to 18. Now you could take this, a little piece of square of this, and you could highlight it, and then it'll break it down even further. So if you just want to look at everybody with an A1C, say 6 or 7 and above, you can break down those patients, and if you hover over those dots, it'll tell you who those patients are. So you can do this practice-wide. You can do it per provider. There's many ways that you can set the parameters of this report so that you can select these patients. In addition to that, when you do select these patients, then you can also create what they call campaigns, where you could do outreach to these patients either through phone calls, you could do it through emails. They have many different campaigns, which we love. We're going to start using for people who are missing mammograms, they're missing lab work, they're missing diabetic eye exams, their colorectal cancer screenings, anything to do with weight management. You can send out thank you notes for thanks for coming in to see us. There's many, many things that you can do with the campaigns that Vital's created based on a certain population of people that you're able to just schedule that to go out. So we like this because we're able to break it down patient to patient on a larger scale as opposed to every patient that comes in on the schedule. It's very easy for us to capture patients that are coming into the office. It's more of a struggle to capture the ones that aren't coming in at all, and that's where this helps, because this will give us that list of patients that we know have to come in but haven't been in. So there's those two types of patients that we're capturing using these products. So the result of this is that we were using FITEL to attribute and then measure our quality data, which we were unable to do to this level before. We've identified over 15,000 patients with chronic or preventative care gaps, and the outbound messaging and communication results in 43% of our patients contacting the physician within 60 days, which is significant for us. And if you think of that on a manual basis, that's probably almost impossible to do. So to get 43% of those patients to call us back within the time frame that they receive phone calls was pretty impressive. Our no-show rates for appointments dropped below 5%, and our providers see anywhere from 24 to 30 patients a day. And with the remind calls going out, and we actually can send them again. So what we typically will do is we'll send reminders a couple days in advance, and for anybody who's a half an hour or more appointment, we'll send another reminder the day before, which is nice because we can manually resend those. And our rapid return on investment, which I had already spoken about, was very telling once those appointments started to be, once those appointments were made by our patients. So I have to say, for me in closing, is that the FITEL team, the implementation team, was fantastic. They were very helpful. They came on site. They worked with us for 2 or 3 days to make sure that everything that we chose in protocols was correct and accurate and where it was coming from, within the chart. They reviewed every element and where it was located in EMR. We've had weekly, semi-weekly calls for support questions, and they were great in responding to emails after implementation to make sure we were all set. So it was a great experience for us, and we'll continue to use it as, the need for population management is out there, which we all know is certainly not going away. But this is a great tool that we're using on a daily basis to take care of our patients. So hopefully that was helpful, and thank you. Guy, you there?
Yes, thank you, Deb. That was fantastic. At this point, we'll go ahead and take questions. Feel free to submit your questions using the Q&A section of the GoToWebinar controls. And we've got a number of questions. We'll distribute these as we go. We've got a few minutes to take as many as we can. The first question was regarding the NCQA. There's been a number of questions actually regarding the NCQA auto credit for PCMH, and I can answer this briefly. If you are a FITEL customer and are using the FITEL solution for over 60 days, you will get what NCQA calls auto credit for some of the elements that are related to population health and outreach. And there's a number of different, there's basically a cross-docketing grid that actually shows you how to do that and how to apply for the auto credit. So that is available with 2011 standards. As everyone probably is aware, the 2014 standards going to be already released and will be crosswalked with that same auto credit process. And we're in the process of working with NCQA to review our products against their newest guidelines, 2014. But the question from one of the participants was, did you receive 2008 or 2011 NCQA recognition?
Both. We received both.
Okay, great. And as I indicated, our product does align with the newest standards. Lots of questions come in, so we'll keep going. The next question is, does FITEL work with health plans without a partnering provider group? FITEL sells directly to health provider organizations, medical group practices, multi-specialty group practices, health systems, and in a lot of cases, those health systems are working with different payer programs for value-based care or for quality-based incentives and programs. So that's typically how our business model works, and we're able to match our guidelines and our tracking measures against the programs that might be in your area. Next question was, what is the EMR used at Dairy Medical?
We use Allscripts Pro.
And next question is, how long approximately did it take FITEL to reach the 15,000 patients? I'm trying to remember the actual slide that had that on there, but I believe that was a period of time for a 1 year period of time.
I think it was 1 year period of time. That's all we could count. Yeah, it was 1 year.
Okay, great. Next question is, can FITEL's product, and I'll answer this, help benefit a health plan trying to improve star ratings and remove gaps in care? Absolutely, in the right way. We're able to hook into existing clinical data, EMR data, and billing data, and then use that information to normalize it, distribute the providers and patients, and engage patients through the process. Can you talk a little bit about the length of time to implement the solution from the time you all got started?
Which product? I'm sorry, guys. Say that again. Which product was that implemented?
I guess just you're right. There's multiple products, but for outreach, how long approximately did that take to install?
Oh, the outreach was very quick. It was actually very quick because there was just an interface from our current billing database that was just extracted, and then the phone calls were made. I'm guessing within 30 days. I'm trying to remember back 4 years, but I'm guessing it was fairly quickly with the outreach. Insight and Coordinate, where there was there was more detailed as far as the elements of the protocols. That took a little bit longer because we had to get that all set up and locate where that was in the EMR, because originally there was no EMR interface with FITEL when we first started doing the outreach. The outreach was all based on billing data, and over the last 4 years, FITEL has grown to the point where they were able to extract the data out of the EMR, which is where we are now with the Insight and Coordinate piece, which was nice because we had asked for that 4 years ago. So they came through for us on that one. So yes, it was a little bit longer with the Insight and Coordinate piece because it was extracted out of EMR, but maybe about, I'm guessing, 30 to 60 days, if that, for the outreach phone calls.
Okay, excellent. Do you have any questions? I guess this is a patient response question. Do you have any data indicating if patients are more likely to respond to certain protocols or conditions? Do you have any insight in terms of what people are responding to in terms of preventive care or chronic care?
Yeah, I think it's a combination of everything. We certainly do have some patients that say, please don't bother me anymore and take me off your calling list, because they just don't want to hear that they're supposed to be coming in for certain things, which is fine, because you're able to opt them out. So there is a mechanism where you can take them off the list. They will no longer receive phone calls, which we obviously don't like to do. But they can get certain phone calls for certain things. There are, for instance, if a patient's had a mastectomy, you can opt them out of mammogram reminders. If they're no longer needing PAPs, you can opt them out of the PAP reminders. So you can certainly opt them out for certain things based on their condition, and patients can actually ask to be opted out. But we try and encourage them not to do that, because we would like to be able to remind them, to come in for, what's necessary, especially if they have, something chronic. We don't get too many complaints anymore. We used to get complaints, but because it was so new, and people are like, why do you keep calling me? And we basically say, well, if you responded to us and made an appointment, then we won't call you anymore, and they got it. So once they made the appointment, they didn't get a phone call.
Okay, we have time for a few more questions. Feel free to keep submitting them. Next question is, what differentiated FITEL from others that you might have looked at? Why would you say, or why would you recommend FITEL?
I guess because of the amount of protocols that were available. We actually had an option to go through Allscripts for an outreach type of software, but they didn't have a lot of the protocols that FITEL had. They didn't have the mechanisms that FITEL had as far as the automation. There's a lot of confusion as far as whether it was the setup that we had to do on our end, They weren't able to come up with the gaps in care like Fitel did. And we had originally started with Fitel after coming off of Smart Talk for just appointment reminders. And then after the appointment reminders came the outreach reminders. So it was just a work in progress that we decided to go with Fitel. They just had a lot more to offer than some of the other companies out there as far as what they could capture without us having to do it manually.
Excellent. I guess the last question has to do with the type of workflows that you're implementing now with the Coordinate product and Insight product. Can you talk a little bit about how your registered nurses and NAs kind of use the product?
Okay, so when the reports come up on a daily dashboard, like I had said earlier, it's based on that provider's schedule for that day. Other than same-day acutes, you won't see those patients come over as quickly. But what it does is it gives you, and you're able to query this, it gives you how many gaps each patient has. And our MAs are able to open that patient chart, and they're able to see which gaps in care that patient has, and they're communicating that to the provider within the reason for visit. So if the patient, for instance, is here for a blood pressure follow-up, in the reason for visit, the MA will also write a note to the provider saying the patient is also due for, an A1C or whatever it may be, a diabetic eye exam is missing. So they're able to communicate that to the doc. So the doc doesn't have to have the dashboard open at the same time as the MA. So the MA is just, because we have one-to-one MAs here, and we have more MAs than nurses. We're very light on nurses, and we really utilize our medical assistants to help the providers capture a lot of this for patients. And they'll capture the mammograms. We're able to send patients right downstairs to an imaging department to get their mammogram same day if we need to. So we're trying to capture those people while they're here. And then, like I said, we're starting to look at these reports a few days in advance so that if the patient is missing any type of lab work, whether it be an LDL or A1C or whatever the case may be, that we're able to ask the patient to go, say that you were due, and please have it done before the visit. So it's still a work in progress, but right now it seems to be working well for the way that we have it set up at this point.
Great. Well, there's still a number of questions. I think we've answered most of them. If there are any that we did omit, I apologize. We'll feel free to send that to you directly after the webinar, as we indicated. Also, as I indicated, everyone on today's webinar will be receiving a copy of the patient engagement white paper, and we hope that will be helpful for you as you continue to move towards kind of value-based care opportunities. And appreciate Deb Donovan and all your time. And I want to thank the Dairy Medical Center for sitting on our call today. That was fantastic. And
thank you.
It was very insightful. Appreciate it.
Thank you, Guy.
Okay, at this point, the webinar has ended. Have a great day. Thank you so much.